Have you ever felt like your emotions are on a roller coaster ride? One moment you're on top of the world and the next, you feel like you're at rock bottom. If this sounds familiar, you might be wondering whether you're just moody or if something more serious is going on. That's where bipolar disorder comes into play. Bipolar disorder is a mental health condition that affects millions of people worldwide, and it can be challenging to diagnose. However, it's crucial to recognize the signs and symptoms of bipolar disorder so that you can seek proper treatment and improve your quality of life. In this video, we'll explore how to differentiate between normal mood swings and bipolar disorder, and what you can do to manage your symptoms. So, if you're tired of feeling like your emotions are controlling you and you want to take charge of your mental health, just keep on watching. It's not uncommon to experience mood swings from time to time. After all, life can be unpredictable, and it's normal to feel happy, sad, angry, or anxious in response to various events. But for some people, mood swings can become more severe and disruptive, indicating the presence of bipolar disorder. So, what are the differences between regular mood swings and bipolar symptoms? Let's take a closer look. When it comes to mood swings, they tend to be relatively short-lived and predictable. For example, you might feel elated after receiving good news or feel down after a challenging day at work. These mood swings usually resolve on their own, and you can get back to your normal state within a few hours or days. On the other hand, bipolar symptoms are much more intense and persistent. People with bipolar disorder experience episodes of mood swings that can last for weeks or even months. During these episodes, they may feel euphoric and energetic, mania, deeply sad and hopeless, depression, or a mixture of both, mixed state. These mood changes can be triggered by various factors, such as stress, sleep disturbances, medication changes, or substance use. One key distinction between mood swings and bipolar symptoms is the intensity of the mood changes. In bipolar disorder, the mood swings are so severe that they can interfere with daily functioning and relationships. For instance, during a manic episode, someone with bipolar disorder might engage in risky behavior, overspend money, or become aggressive towards others. During a depressive episode, they might struggle to get out of bed, lose interest in activities they used to enjoy, or have suicidal thoughts. Another important factor to consider is the duration of the mood changes. As mentioned earlier, mood swings typically last for a few hours or days. In contrast, bipolar episodes can last for weeks or months, which can be distressing and exhausting for the person experiencing them. Now that we've explored the differences between mood swings and bipolar symptoms, you might be wondering whether your own mood changes are indicative of bipolar disorder. The first step in assessing your situation is to reflect on your personal emotional patterns. Start by paying attention to how you feel on a day-to-day basis and whether your moods are consistent or fluctuating. Do you feel like your moods are stable and consistent, or do you experience intense emotional highs and lows? You can even keep a mood journal to track your feelings over time. Just keep in mind that other triggers may be contributing to your mood changes, such as stress, lack of sleep, or changes in medication. Be sure to record the duration and intensity of your mood swings as well. If you notice that your moods are more extreme than usual, or if you have difficulty regulating your emotions, it may be worth considering seeking professional help. A mental health professional such as a psychologist or psychiatrist can help you determine whether your symptoms meet the criteria for bipolar disorder or another mental health condition. They can also provide you with guidance and support to manage your symptoms effectively. However, it's important to note that self-diagnosis is not recommended. While it's natural to want to understand what's going on with your mental health, trying to diagnose yourself can be dangerous and ineffective. Mental health conditions are complex, and they often require a trained professional to assess and diagnose accurately. Inaccurate self-diagnosis can lead to delays in receiving proper treatment, as well as unnecessary stress and anxiety. While assessing your situation is a crucial first step in managing bipolar disorder, the real work comes in implementing coping strategies and seeking support. Coping with bipolar disorder or mood swings is a unique journey that requires personalized strategies and support. So let's dive into Chapter 3 to explore some practical tips and techniques. First and foremost, practicing self-care is essential for maintaining emotional stability. Take some time to figure out what activities make you feel relaxed and rejuvenated. It could be as simple as taking a bubble bath, going for a walk, or listening to your favorite music. Making time for yourself on a regular basis can help you manage stress and reduce the risk of mood swings. Building a support network is also crucial for managing bipolar disorder. Reach out to friends and family members who you trust and who can offer emotional support, or maybe consider joining a support group where you can connect with others who understand what you're going through. Mental health professionals can also be valuable sources of guidance and support. Don't be afraid to reach out for help if you need it. When it comes to exploring treatment options, it's important to work with your doctor or mental health professional to find a plan that works for you. Medication can be helpful for managing symptoms of bipolar disorder, but it's not always necessary. Therapy can also be an effective treatment option, particularly cognitive behavioral therapy, which can help you develop coping skills and strategies for managing mood swings. Finally, making lifestyle changes can also be helpful for managing bipolar disorder. Incorporating regular exercise into your routine, getting enough sleep, and avoiding drugs and alcohol can all help minimize mood swings. These may not look like a big deal at first glance, but try some and see for yourself how it makes you feel. Try experimenting with different techniques until you find what works best for you. Remember, there's no one-size-fits-all approach to managing bipolar disorder or mood swings. It's always best to take a personalized and flexible approach to coping and seeking support. Having the right strategies and support in place can help someone with bipolar disorder manage their symptoms and live a more fulfilling life. If you or someone you know has bipolar disorder, then the Bipolar Disorder Survival Guide, What You and Your Family Need to Know by David J. Miklowitz is an essential guide that will help you manage symptoms, support a loved one with this condition, navigate challenges, and find hope for the future. And even when managing the challenges of bipolar disorder, you can still learn how to create positive habits and achieve your goals by watching our other video, The Power of Self-Discipline and Dopamine, How to Rewire Your Brain for Success, where we teach you how you can use dopamine to take control of your life and unlock your full potential. Thanks for watching, and we'll see you on our next video here on the Tree of Life channel.